Everybody sounding okay? Testing, testing, testing. I would hate to be the person that had a camera pointed at them like this. It's nerve-wracking.
Hi, everybody. Good afternoon. My name is Tisha Benton, and I am the Vice Chancellor for Communications here at the University of Tennessee, Knoxville. Thank you for being here today. I know everyone has a number of questions, so we want to go ahead and get started. The first thing I want to do is emphasize that we have no cases of coronavirus, also known as COVID-19, on our campus at this time, and we are in regular communications with the Knox County Health Department and understand that so far in Knox County, as of this afternoon, there are no cases in Knox County as well. But we do want to kind of let you know how we've been planning. The leadership team has been involved in operational decisions and contingency planning since the end of January. And as this situation has evolved, so has our planning response to it. And so for the last couple of weeks, we've had the Emergency Operations Center for the university mobilized, and a group of leadership from the university involved in making policy decisions. Just a few minutes ago, Chancellor Plowman had a message that came out updating a message from last week to campus, letting everyone know that effective immediately, in addition to the international travel suspension that we put in place last week, we now also have a domestic travel suspension for non-essential UT-related travel. We are also working with faculty and graduate teaching assistants to prepare in the event that we need to move classes online. So that preparation is happening, and we have ramped up cleaning across campus, and we will also use spring break next week as an opportunity to even further ramp up those cleaning efforts. And so this is really an opportunity to ask university administrators questions regarding our preparedness and our planning. And so I want to introduce who we have with us today: Chris Cimino, Senior Vice Chancellor for Finance and Administration; Frank Cuevas, Interim Vice Chancellor for the Division of Student Life; David Manderscheid, Provost and Senior Vice Chancellor; and Dr. Spencer Gregg, Head of our Student Health Center, and also the Incident Commander in the Emergency Operations Center for this particular issue. So I'm going to step away and let you all ask questions of this team, and we'll go from there. Thank you.
I know there were several students who were studying abroad in a couple of different countries that have since been brought back to the States and have returned. Is everyone back on campus, and have any of them been placed in any type of quarantine or isolation?
We followed CDC guidelines on bringing those students back. In particular, the students from Italy were told to self-isolate as required by CDC guidelines. As far as we know, that's been total compliance. Some of them have gone home to do that. But we've been following CDC guidelines in that respect.
So on that note, they were told to self-isolate, so none of these students who have returned and been told to do that are moving or anything like that, like they're alone?
Right. They are in self-isolation, and none of them have tested positive. None of them have shown symptoms at this point.
I know you guys said that you were preparing to move classes online if needed. What about campus events or games or things like that? Will those be impacted as well?
Chris, you want to take that?
Sure. At this time, we have no plans to cancel any campus events. It is something we're looking at in terms of the numbers of events that we have coming up in the next 30 to 60 days, and we'll continue to monitor that as we go forward.
What's the current contingency plan if a confirmed case of coronavirus were to be on campus or in the Knoxville region?
Yeah, we talked about that today, and we're still looking to find out and look for what that trigger point would be, whether it's in the region or Knox County, and what would that mean for the point at which we take all our courses online. So we still don't have a decision on that.
Like, just to hasten to add, we're meeting almost on a daily basis, to be apprised of these situations and getting constant information from the Knox County Public Health Department.
And I know next week is spring break. Are there any concerns about students or faculty who might be traveling who could potentially bring the virus back to campus, and kind of what would be the move from there if that were to happen?
So
What we have, we'll be putting out information today to students and to staff to encourage them to be safe, obviously, during their time on spring break. In that message that we'll be putting out, it communicates ways that they can do that. It will advise them to kind of give really good consideration about what their travel plans are. This would not be a good time to be traveling to a CDC level 3 alert country like China or Iran, Italy or South Korea. And there could be other countries that get added to that list. The issues that could come up there would be that students may get there in those countries and have difficulty getting back to the United States. They would have to have a isolation or quarantine once they've arrived back, so that could prevent them from getting back to campus when they had initially planned. And even here within the United States, there's areas that are being more adversely affected by the COVID-19. And so just being aware of what local health officials in those areas are recommending is important to know too, because whatever those local health officials tell you to do from the standpoint of self-isolation, you're required to do that. And so it would be important to make sure that you know where your travel plans are going and what their recommendations are, both entering and exiting that area.
Does the campus have the resources to test any students for the virus, any students who are concerned that they might be showing symptoms?
We do not, and that's true across the board for physicians' offices. The only place that COVID testing is available now are through particular labs where the CDC has released those the lab kits for. There were a limited number of those. They're beginning to increase in number now. Any testing that is performed on a patient that patient has to meet certain criteria. Do they have an appropriate travel history that suggests that they could be at risk for COVID? So certainly coming from a place like South Korea, Italy, Iran, or China would be of concern. And then in addition to that, do they have symptoms? So if you find a patient that fits both those criteria, they're symptomatic, and that's symptoms suggestive of COVID, fever, cough, shortness of breath, and they have an appropriate travel history, then you would want to see about having the test performed. That's not up to the individual physician or provider to make that decision. That's only made in consultation with the local health department authorities. And so once like here at UT, we would get in touch with the Knox County Health Department, and we would discuss it with them. If they felt like testing was warranted, then we would go ahead and collect those samples, get those sent to the state lab, which typically is around 24 to 48 hours on a turnaround time for the results, and then we would be able to know what they is. At this point, we've not had to do that. We've given a couple of phone calls to the health department, but just kind of more on just making sure I didn't need to worry about this, and them supporting that, oh yes, that's not something that we would be concerned about at this point.
You said that you were suspending all non-essential travel. Could you just clarify what, was sports travel non-essential, or what would you consider?
Sporting events in terms of, and that domestic travel is out of state, so it's only out of state travel. And it would be non-team, team travel would be okay. It was the non-team travel that would be suspended in terms of athletics. And then it's all other faculty and staff travel that may be in the works for conferences and other trips across the U.S.
I would add there that many of these conferences that, for example, I was scheduled to go to a conference in San Diego on Friday, and it was canceled. So many of these events are already being canceled.
We have many viewers asked us about this, so we're going to ask you, in regards to students who may be from countries who have been quarantined or have a high level of cases, has the university had any instances of maybe discrimination or people feeling uncomfortable on campus because maybe they come from one of those countries?
With respect to that, we have not had reported incidences of that situations. Our Dean of Students Office is providing support to all students if they have concerns. And we would, if those were to arise, we would follow normal protocols to follow up and make sure that those students who are experiencing any adverse response would be the appropriate support.
Can you talk a little bit about what the screening process looks like that you guys are going through and then how that'll increase next week with campuses a little bit easier?
Absolutely. So we have over 280 buildings on campus and 15 million square feet. We have a thorough cleaning process already in place, but in the last few weeks, we have actually stepped that up with additional cleaning. What that looks like is going through buildings after hours in order to do additional cleaning around handles and doorknobs and classroom seating and surface areas. We continue to do that through spring break, and in addition, in spring break, we will just be able to get into even more of the classrooms, more of the offices, and carry out that cleaning even further.
And has there been any cleaning implemented in your spaces where students are spending a lot of their time?
We have actually implemented additional cleaning routines daily in all the residence halls, and particularly in the high-traffic areas where we know that we're going to have more students trafficking through. So that has ramped up. And similar to what's happening across campus next week, our staff will be going through and doing some very deep cleaning in all those areas.
I'd like to add something too. The Center for Disease Control has issued guidance on their recommendations for cleaning at where we're at this point with the outbreak, but how to step those procedures up and what more needs to be done if you were to actually have a patient or a student that's under investigation or has actually been diagnosed with COVID-19. So if we actually had a student here that was under investigation for COVID or had been diagnosed with it, then there would be additional cleaning measures that are recommended by the CDC that we would adhere to for that.
So I actually just had seen that update because we're running, and I saw she was asking all faculty graduate assistants to prepare to move classes online in the instance that on-campus classes wouldn't be happening anymore. Can you kind of talk about maybe what reasons would make that move into the official online step?
Right. This is, we have to evaluate it at any given time. We don't feel that that's necessary at this point because there have been no confirmed campus cases. But if you look at other schools like Vanderbilt, for example, when there was a confirmed case involving one of their students who came back from Italy, that's when they chose to move online. We haven't decided what those triggers would be at this point because it is evolving, but that would be one example of something we might look at. Yeah, thank you.
Are you all in communication with campus officials at other colleges who have made that step to sort of decide what your one's going to be basing it off of what other colleges have done before?
Absolutely. For example, the SCC provost, we have a very active listserv. So last week when we were talking about a travel ban on international travel, that was discussed. What are you doing? Similarly, I'm sure that when they see that we've banned domestic travel, except within the state of Tennessee, that will be, which I'm going to share now that it's public, they'll be asking questions about that also. So yes, we're looking at what other institutions in the SCC are doing, what other institutions nationally are doing, and then also what other institutions in the state of Tennessee is doing. The chancellor's in contact with the TEAC, Tennessee Higher Education Committee, Council, and Mike Krause. So yes, we are looking at what other universities are doing. We don't want to reinvent the wheel here, so we want to do best practices. Thank you.
Is there a status update of the students that were visiting here from Japan that were moved into quarantine?
Right. Those students are now, and maybe others can comment on this too, there were 12 students that came to Japan that came under guidance that it was safe for them to come to the United States, but then right after they arrived here, those 12 students, the CDC changed the guidance and said they should not congregate. They didn't go so far as to say self-isolate, but we made the decision that we needed to isolate them from other student populations, so we did so. None of the students has shown any signs of the virus, where their self-isolation ends the 17th, if I recall correctly, of March, so they're about a week into that. Yeah.
If the university were to decide to suspend operations temporarily, is there a plan as to what will happen to students who are currently living on campus? Would they be required to move off of campus, or would dorm buildings
that's something that we would continue to work through. As we said, this is an evolving situation. So one of the issues that we're talking through is what would that look like for our students? Obviously, we would want to limit the interaction. So having that many students in a residential environment would be counter to what we're trying to do. So we would be working through those.
We are currently continuing campus tours, but we are asking for lists of students who are coming to campus and seeing if there's any concerns on our part. But we're planning to continue campus tours at this point. Yeah, but that could change. Things could be reevaluated.
And in regards to the spring break travel, I saw definitely about what do you have to say that to the students that are going internationally? I know there's like a good few that are, people that are going cruises, stuff like that. What's kind of the plan on ways to deal with that when they fall on that?
What we will adhere to are the CDC's guidelines on those individuals that are returning. So presently, the guidelines are that if you have been around a person that has been diagnosed with COVID infection, if you're coming from a level 3 alert country, then those are individuals that should be isolated from other people until that 14-day period is over with and they clearly have not exhibited any signs or symptoms. If they get sick during that time period, then it would potentially be even a longer period of time that they have to stay isolated. In addition, because of the difficulty with truly isolating a patient on a college campus, we've also taken the step of advising that if there's a level 2 country that's involved, which doesn't require isolation from the CDC, but just does require requests limited contact. So we've requested that if you're coming from a level 2 country, that you adhere to those recommendations, and for each of those categories, if you've been around someone that's been diagnosed with COVID, if you're coming from a level 3 country, or if you're coming from a level 2 country, then we're requesting that you not return to campus until that 14-day period has elapsed and you've been free of symptoms during that entire time.
And a really quick follow-up. I think another question too is how is like the campus going to kind of, this is going to be weird, but kind of know who's going out of the country? Is there like a mass email not just
Well, we have not, to this point, made a request for that. We are aware of those that would have been going on university-related travel, and of course have requested those to come back. That would be a purely voluntary thing for students to do, and so they're certainly not under any obligation to make us aware of that. But what we would just advise them is that if they're going, when they return to the United States, they're going to be given directives through the Center for Disease Control about self-isolation, and our anticipation is that they will adhere to those. I would also mention that the local health authorities have broad authority in regard to enforcing those isolation periods. So it's not anything that I would feel comfortable attempting to circumvent.
There is a petition online currently to put classes on hiatus until further notice, and it's received, last time I checked, over 4,000 signatures. So I'm curious, are these efforts by students to voice their opinion on what should be done? Is there any way for those to be taken into consideration, or is this mostly just about CDC recommendations and official policies?
Well, most certainly we have seen that petition and we have seen that concern on students' part, and we did take that into account in making our decisions. But at this point, there have been no cases on campus, and there's been nobody that's even been tested at this point, so that we felt we should be prepared, and we understand the students' concerns most vividly, but it wasn't necessary at this point.
leadership team and the Emergency Operations Center are constantly reviewing new information, and decisions are changing as that happens. And that is the nature of, I think, this kind of situation. And so we recognize the evolving nature of this and are committed to continually reassessing things. So again, a decision today doesn't mean it's a decision tomorrow. And that's one of the reasons that when you've seen the chancellor's email and an email from the provost will be going to faculty and Dr. Gregg to students, that it talks about when you leave for spring break, take your things with you so that you are prepared to be able to be in a class online should the decision change and that becomes necessary. Using spring break for faculty to be able to prepare to go onto an online environment should that become necessary. So again, nothing is off the table, but we also want to make sure that we are absolutely prepared, but we are not panicked in that. And so that is how we are trying to navigate these decisions on a daily basis.
If I may give an example of that, with Italy, we were prepared. When Italy went to level 3, we were in contact with those students almost immediately. It went to level 3 approximately 5 o'clock on a Friday afternoon, 11 p.m. in Italy. We were emailing those students. We were calling them the next morning and getting them out as soon as possible. So that was we were prepared to make those decisions, but we didn't feel it was necessary at that point. But then when it became necessary, we acted very quickly and decisively.
I think the other thing is that we're encouraging our students to have conversations with their families. As things are evolving and changing, we want not only for the students to notify their families where they're going, where they're traveling, but also what would the plan look like, and if they're either about returning to campus or if they're feeling, have symptoms, what they should do to be able to make sure they can self-isolate and seek the assistance they need.